All right, welcome everybody. We are going to go through our standard precautions training tonight. This is a mandatory training for anyone prior to working in the classroom, so it's really important what we're doing tonight, what you're watching here. First thing I want you to do is take notes. You'll have a test at the end to complete. That test might be in front of you right now. Either way is just fine. However, what we're going to talk about tonight is about keeping yourself safe and keeping those around you safe, keeping the environment safe. And we do that by taking precautions, taking standard precautions. So this is an OSHA fact sheet here. Standard precautions is involved with bloodborne pathogen standard. And I'm not going to do a lot of reading to you tonight, but there's a few things I want to make sure you capture. Bloodborne pathogens are infectious microorganisms present in the blood that can cause disease in humans. They can include, but are not limited to, hepatitis B, hep C, HIV, which causes AIDS. And so being exposed to these pathogens can put you at risk for serious or life-threatening illnesses. So we need to make sure we're aware of how to keep ourselves safe from these. So we'll talk so much about keeping ourselves safe, precautions. Here's a rule: you got to take this class, part of working with kids. Why do you need to take the class? Because we need to keep you and others safe from that transmission. There's lots of things we can do to prevent the spread of illness and disease. That's why we're doing this today. What are standard precautions? These are precautions that are going to keep, again, minimizing risk. Eliminating risk is not possible, so we're going to talk about minimizing risk. We can do it in our field through using gloves, like you mentioned before, hand washing, cleaning the environment around us, the surfaces, and then disposing of any critical material like an EpiPen or paper towels full of blood from a nosebleed. What do you do with that? You don't throw that on the top of the trash can, because other children now could get exposed to those. So we're going to talk about some ways to dispose of critical matter, we'll call it. All right. So we're going to talk about prevention, reducing your risk, what to do if you are exposed. We'll talk about some learning scenarios. We'll review the exposure control plan, and we've got a test which for you is not optional. All right, section 1, preventing and control of infectious diseases. So how do illnesses spread? Okay, they can spread through blood or other potential infectious materials such as urine, such as fecal matter, such as saliva, okay? Direct contact or touching, airborne, fecal, oral. So it's got to enter your body somehow, okay? Here's how you can think of it too. There's got to be a component. There's got to be, let's say, an infectious element, okay? And then it's got to be, there has to be enough of it, okay? So just because you're exposed to someone that has an infectious disease, if you're not exposed to enough of it, you may not contract that illness. It's got to get into you somehow. There's got to be an entry site. So they've got to have it. There's got to be enough of it. There's got to be an entry site. And then your body has to be able to not fight it off. Okay, so there's like hepatitis. There's certain hepatitis that you can get an immunization shot to protect you. So it also depends on how healthy you are, how able your body is to fight these illnesses off. Again, so we talked about blood. Again, it could be a nosebleed, a scratch, or an abrasion of some sort. Again, there's fluid that's containing visible blood, secretions, body fluid that cannot be identified. All are potential infectious bloodborne pathogens. HIV, what is HIV? Human immunodeficiency virus. It means your immune system is just weakening so much. So people that suffer from HIV suffer from they contract a lot of other illnesses because their immunization system is not healthy. Hepatitis. This is your, anyone? That is your liver, okay? This is your liver on hepatitis. Just kidding. But hepatitis attacks your liver, so that's what it does. Hepatitis B, vaccine and preventable. So there is a vaccine for hepatitis B, but there is no cure for it. Okay? It's much more contagious than HIV. Some people may have it and not have symptoms at all. Again, it talks about beginning as an acute infection, resulting in chronic disease, and long-term, there it is, liver problems. Hepatitis B is transmitted through needle sticks from mother to fetus, or can be transmitted through sexual contact. Hepatitis C, there's no vaccine available, and there's no cure. Okay, so this is a much more serious form of hepatitis. Acute infection again, we're attacking the liver. Most chronic blood-borne infection, and often again spread through needles, mother to fetus, sexual contact as well. Direct contact or touching, let's talk about that. Hang on, buddy, you got a little bit on your face there. All right, airborne, again, in other ways that illnesses can be spread. Fecal matter, that's why it's so important. What does this individual not have on? Gloves, but this is mom, okay? It's just a picture, don't get all excited. All right, but that's why it's so important for us to wear gloves when we're changing diapers. It's important for us to be aware of kiddos with their hands in their mouth or in their nose. Can you see that all right? Watch this. You see that? All right, Hep A, vaccine and preventable, okay? Some infected people may not have symptoms. They usually improve without treatment, okay? Spread through oral fecal route, not through blood, does not become chronic, most often contaminated water and food, okay? So the least severe on the Hep cycles. Control the spread. Proper hand washing is the biggest thing that you can do to keep yourself safe and keep your kids safe, okay? Again, the first thing you do when you come to work, when a kid enters the classroom, washing the hands, all right? Proper cleaning and sanitizing, so you need to make sure you understand our sanitizing products and our disinfectant. There's a difference between the two, okay? Let's touch on that real quick. And you have to understand, based on the type of chemical we have, when you spray it on a surface, how long it needs to sit before you wipe it off. Because when you spray it and wipe it immediately, it's not killing germs and the critical bacteria that we need to. And it just depends on the chemical. So the chemical we use right now for sanitizer might be 1 minute. And I say might be because you need to read the label. And we put separate instruction labels on it to make it really easy for you. So to sanitize surfaces that we have contact with, body contact, okay? That might be a table or a chair, a bookshelf, cubbies, light switches. We're gonna disinfect, where'd you go? We're gonna disinfect areas where bodily fluids come in contact. That's gonna be a diaper changing table. That's gonna be a drinking fountain. That's gonna be a sink. That's going to be a toilet. So bathrooms are going to be disinfected. Tables and chairs are going to be sanitized. Ventilation, making sure that ventilation is happening, doors open, windows open when properly needed. So be proactive. Hand washing, regular health consultation. So our nurse consultant comes every month. If you have questions about kiddos in your care, oh, hey, this one's got this today. Can you come over here and look at this? We got to make sure we're not trying to diagnose the children in our program, but we always have to do that quick health check on them. And that's every child when they come through that door every single day. You have to physically touch every one. And when I say physically, meaning, hey, it might be just, hey, welcome, checking you out, or notice that they don't look good or they look flushed, look red. And you might literally touch them and go, hey, how are you doing today? Wow, you are on fire. You doing okay? Well, mommy gave me medicine right before, I came in, but I did throw up. That's what I mean by touching kids. Touch base with them. Or maybe physically touching their head to see, if they're on fire. And listening to parents. How'd you sleep? Asking parents, oh, did you give any medicine this morning? And ask it like, oh, no big deal, inquisitive. Oh, did you happen to give him any medicine this morning? Yeah, he kind of woke up a little warm, so I gave him some Tylenol. Gotcha. Pay attention to that because that's a sign this child is probably contagious. Probably. Because that pre-fever and early fever is the most significant signs when they're contagious. So again, and if you have major concerns, we can actually call our health consultant to get questions about that. Working with parents, we try to educate parents about getting their child immunized. Look for signs, again, through our daily health check of infectious disease. Communication. Building trust with parents so you've got good open communication is critical. And of course, understanding our previously developed health policies that we have. Here are some of the illnesses that must be reported. If a child has, we find out the child has meningitis, has giardia, has varicella, salmonella, we're required to report that to the local health department. Okay, let's define an outbreak real quick. Okay, so a child with a fever in the preschool room sent home on the same day as a child in pre-K with a fever, is that an outbreak? Are we freaking out? No, not an outbreak. But if you have 4 or 5 kids that are being sent home, let's say in the same day, same classroom, that becomes a concern. And by this definition, that would be considered an outbreak. So we're required to keep an illness log. You'll see those in the offices. And so we need to make sure we communicate. This child got sent home. Here was a symptom. Here's the duration, and when they came back with or without a doctor's note, and so forth. So that's in there for us to do. And as we have outbreaks, this is where we need to make a simple phone call, and the director or I will do that to the local county health department so that they can keep a track of that. Okay, what would you do in this scenario? On Monday, you have 3 children go home sick. One's vomiting, one with a headache, and one with a cough or fever. And then on Wednesday of the same week, you have 2 teachers call in sick and 4 children go home vomiting. What are we going to do? What steps are we going to take here?
Well, on Monday, you should sanitize all of the toys and clean the room.
You got it. On Monday, we've got 3 different symptoms. We're cleaning, so forth. We're talking to parents, right? Yep. And then what do we do on Wednesday on that same week?
Over again.
Same thing. It seems like it's sometimes a deal, right? Like you do that like every day. It's like, oh, well, there's 4 more. There's 4 more. But when you get into 4 children go home vomiting, then that becomes more of a concentrated. Hey, we might have a specific bug going on in here. And sometimes a phone call to the health department, they could say, hey, did you know neurovirus is going around right now? Because one of the physicians that's a parent with us today just told me that, said, hey, it's going around. It's going around with your neighbor over here at the nursing home. And I said, well, we haven't heard it, seen it, but thank you. And so sometimes that's what that communication with the local health department and our health consultant there can get everybody on the same page. There we go. Why should you not always exclude children? Well, if they've already been exposed, okay, once treatment begins, some are not contagious. So strep, for example, common. Right? They get a strep test. It's 24 hours from the time they take that first dose. They're no longer contagious. They're welcome to come back. They might still have some symptoms like what? Sore throat, runny nose. Lice, once treated, are not contagious. Now school districts have a no-nit policy, okay, which is a strict procedure. So some professionals say a no-nit policy is appropriate. Others say it's not necessary. Do not exclude those kids. Our local school district does not have a no-nit policy, so children, once treated, can come right back. I think within 24 hours, even with nits, which are eggs, which could eventually hatch. So that's where there's a little bit, but in the district, they don't want to preclude children from an education. So they have a little bit different approach. Our approach on the no-nit is, hey, preschool is important. However, you'll still get to kindergarten, still get hit with dittos, so you'll probably end up just fine if you end up missing a week. All right. Reasons to exclude. They don't feel well enough to participate in normal activities. This will be a child that won't engage and just wants to stay in cozy corner all day. That is a reason to exclude. They need to be under the care of a family or a physician. If you cannot care for them without interfering with the care of other children, right? You can't run your classroom because you're having to play nurse. That's a time where we need to exclude. And the illness is on the how sick is too sick document. So we have a health policy on when parents need to come pick up their child or when to keep them home. So if it hits in that policy there, they need to be out. But if they can't participate or you can't run a classroom, those are two other good reasons to exclude kiddos. Always work with your director. Do not just randomly call parents and say, you need to pick up, you need to pick up. We need to be sensitive to working parents, okay, and not call them every time their child coughs or has a runny nose or has green boogers, okay? That's where we use standard precautions, okay, to make sure we've got a good environment. So be sensitive, but work with your director to learn and find out when is the right time, and you'll learn as more and more you're with us, when to exclude, when to just call and let parents know, hey, just a heads up, doesn't have a fever, it's running 99, so really low, but not acting himself. So just want to give you a heads up, because that parent might be like, you know what, I was looking to get out of work today, I'll be there in 10 minutes, and you're like, thank heavens. Okay, you might have kept 7 other kids safe, or they might go, hey, thanks for letting me know, I'll make a backup plan, okay? Or they might go, well, I ain't got nobody else to pick them up today, so I don't know what to tell you. And that's where you have an opportunity to say, well, you might want to really work on that backup plan. You don't have to get him now, but if he does hit 100 degrees, which is in this section here, how sick is too sick, somebody is going to have to pick him up. And we'll have about a half an hour pickup window is all. It's good to plant that seed, let them know. All right, reduce the risk. We're going to do that through hygiene, hand washing, right? Gloves. We're cleaning, sanitizing, disinfecting, which we learned a lot about that also in our orientation video. Hygiene, coughing etiquette, and waste disposal. All right, washing our hands. Y'all know how to wash your hands? Thought so. Put the soap on your hands, run them under the water. If it's a foam soap, you can do this for 20 seconds and then put them underneath the sink to rinse them. If it's a liquid, then they actually need to put the liquid on their hands and then get them wet and then lather for 20 seconds. That's a heck of a long time. When you come to work, when you enter a different classroom, okay, before handling food or feeding kiddos, after using the toilet or the changing table, always, we should not and do not have signs in our facilities that say, staff, wash your hands after going to the bathroom. Okay, we should not have to, and that's why we don't. After coughing, yep. After playing on the playground, coming in from outdoor play, we're required to wash our hands. Okay. After handling pets, after water play and sensory, when they're dirty, how about that, guys, just in case you didn't know. Before and after handling medication, that's a really important one. After cleaning, sanitize, removing gloves, and before going home. The difference between hand washing and sanitizer is this. We just hand wash. The only time we're going to use sanitizer if we're on a field trip and there's no running water, for example. That's it. That's about the only time we would use it. Staff are able to use it, but we cannot use that in place of hand washing because it takes too long or it's too hard to get 5 toddlers or 10 toddlers to wash their hands. So this isn't a lazy man's excuse. But really, field trips, we don't have running water. Or if our water was shut off because we had a pipe break, then we would use hand sanitizer, for example. Wearing gloves, really important. Put them on. Wear gloves, okay? Removing. All right, so we're going to do a quick exercise here. Ladies, you've got some gloves in front of you. Go ahead and put your gloves on for me real quick. And you all at home, put your gloves on. Bring out your red paint. Actually, we'll do this when you turn in your test. In the director's office, I'll have gloves, red paint. We'll do this quick exercise. We've got my lovely assistants over here. And we've got our gloves on. So that paint just turned to blood. Okay? Smear that blood all around in between your fingers. Now stop. Now the key is we wanted to get our gloves off without getting blood on ourselves. Okay? So here's the thing, is that we need to make sure that we don't have any bare skin touching the red, okay? So I can't just come underneath here. Well, I can actually the first time. I can take my fingers there's a lot of different techniques. You might find one that works best for you. Okay, if I take it completely off, depending on the blood's in there, but I've got a bare hand touching this one, right? So it's better if I had it on, take it off a little bit, and then I can use this. For example, I can pinch and pull, and again, everything's inside of itself. So again, that was kind of a sloppy example, but give it a shot. Take one glove off, sometimes halfway. If you come under with the second one, you're good. Pretty good. The big thing is, as you're like in between diaper changes and stuff like that, practice taking it off, because it's really about learning a technique that works for you. There's a lot of them, so that you don't have get blood on yourself. And then what about throwing it away? Is that the inside or the outside, right? So always be conscious about that. Okay, let's move over to personal care and hygiene. Eating, drinking, personal hygiene, makeup. It's kind of a funny slide, so don't do your makeup at preschool. All right, let's start with that. Don't put your contacts in when you're applying first aid. Okay, interesting slide, I think. Try to make sense of it. I'll let you try it home. All right, diaper changing. We need to wear gloves always when diaper changing. And you need to wear different gloves for every child. Did you know that? So you're going to change gloves in between. Wash your hands, put your gloves on, change the diaper, take your gloves off, take care of the kiddo, wash their hands. Guess what? Wash your hands again, put your gloves on, and repeat the process. All right? Contaminated laundry. So wear gloves when handling laundry or contaminated blood. Okay? So if a child has an accident, you're going to help them, put gloves on. Okay? And then when handling their underwear or their shirt or their pants, so they have urine on them, you've got your gloves, just be careful. Okay? And then Walmart sack, put them in there, double that up, tie it up. Okay? If there's poop in their underwear, don't go rinsing it out in the sink. Don't rinse it out in the toilet. You cannot do that. That is against the regulations. Okay? If you get a big dry, hard poopy, you can drop it in the toilet. That's fine. Flush it. Okay? If you're in a position where you can't do that, then wrap it up. Okay? And then put that in that Walmart sack. Get a piece of paper. Write that child's name on that sack. Staple it to that Walmart sack. And then go in your bathroom. You'll have a shelf in your bathroom, in each classroom, that's labeled contaminated clothing. All right, and that's where that goes. So that when that goes home at the end of the day, we can re-sanitize that shelf. That stuff should not go in cubbies. It should not go in backpacks, because that's kind of gross. Because if you put that in their bucket or their cubby, that means you got to sanitize that whole area. So that's why we have a designated shelf in the bathrooms for that. Contaminated laundry, well, we kind of talked about that, right? Bags up, and that goes home. Otherwise, you'd wash it at 165 degrees. Send it home. Sharps. Don't pick them up with bare hands. Don't bend them. Break them. Take off the needle. Do put them in a dispenser like this. An EpiPen. Once you inject a child with an EpiPen, that needle is out. Okay, that needle doesn't always retract. Technology is changing, but that needle is likely still out there. You could put that into a soda bottle and then give that to EMS. Okay, so always think about safe disposal of these items. All right, safe sneeze.
Now we're going to be testing some techniques for stopping sneezes from spreading their wares, their germs, their bacteria, and that's what this rig is set up to test. Jamie and I will wear white suits, like I'm wearing now, and stand here at the apex, and we will sneeze. And of course, our mouths will be filled with colored liquid like before. We're going to try and prevent the spread of that sneeze with 3 different methods. 1, open hand. Hatching! 2, into the elbow. Hatching! And 3, something no gentleman should be without, a handkerchief. Hatching! We're going to be looking at our suits and on the floor to see which one works the best. Sneezing into the open hand. I'm predicting this is going to be kind of a horror show. A swig and a sniff later.
That's one.
Yeah. Oh, there's another one coming. For each style,
they're going to unleash a sample of 3 sneezes.
Oh, it looks horrible, doesn't it? I look like a vampire. Ah!
Adam's face is a picture, but it's the canvas that tells the real story.
I see spots up to 8 feet away, dude.
Yeah, it did spread quite a lot, but there's a lot of markings here. So I'd say single hand, not so good.
Yeah, not so good.
Not so good, and then some. Even with his hand directly in front of the oncoming sneeze, Adam can't begin to contain the explosion.
Now, I'm pretty clear that sneezing into your hand is meant as a courtesy to those around you to keep from spreading your germs onto them. And as far as I can see, it's quite effective at doing exactly the opposite. I noticed there's almost no red dye on me at all, and crap loads all around me. If I was on a subway, I'm Typhoid Mary.
With the hand getting the thumbs down, can the elbow do any better? To find out, it's over to Jamie, and he'll be sneezing in green.
Now, we wait for the sneeze to take effect on Jamie's Hoosier nose. Slowly, it irritates the cilia inside.
And with the cilia salivating, three sneezes later, and the results are very impressive.
Yeah, I see only 2 droplets and 1 on your shoe, and let's look at your elbow hair. That's totally localized to you, man.
And you know what? It's all on my arm and not on my hand, so I'm not as likely to spread it around.
Yeah, it's doubly effective.
Hands down, the elbow is a highly effective technique, with virtually the entire sneeze contained on each of Jamie's sneezes. But can the humble hanky do better still? Well, it's back to Adam, and for this final test, he's sneezing in blue.
How do we do? I see a tiny dot of blue there.
At first, it seems like the hanky may be victorious, until...
I see some on the hanky.
And look, it's penetrated all the way to both sides.
It's penetrated both sides, and perhaps most damningly, ooh, it's on my hands, ready to spread to the next person whose hand I shake.
The sneeze seeped through the hanky, contaminating Adam's hand, making it a pretty poor technique. And it gets worse.
Let me make one more thing clear about this hanky I'm holding here. Imagine, achoo, you sneeze in it all day long. You keep on putting it in your pocket, pulling it back out, giving people change from your pocket, handing them your pen, handing them your phone, talking on your phone, spreading germs. Yeah, it's not just a Rorschach test, it's a petri dish.
Although the droplets were contained, the hand exposure means the hanky has hit the skids.
So, this flu season, which method are you going to use? The hand, the elbow, or the handkerchief?
It's got to be the elbow.
I totally agree. It's the elbow.
So now you know.
Coming up.
You look like a pretty strange.
Okay, so by far, teaching our kiddos to use their bat cape or their Superman, they do their cape and sneeze into their arm, is what we want to do. So the beginning of the school year, throughout the school year, we need to reinforce that. Flu, cold season, reinforce. And when do we do that? Circle time. How about it outside? Be a great place to do that, where we have a little bit of space, so that as the kids are going achoo and missing their elbow, they're not spitting on their friends. So it's a great outdoor activity and an appropriate indoor activity for the right number of kids and the right number of space. So, okay, let's move on. How about a spill control kit? Y'all have this? Yeah, we have buckets, we have shovels, this is what we do. The most important thing is, if we have a spill, whether it's vomit or whether it's blood, we want to isolate that area, move other children out of that area, get that, protect yourself, okay, glove up, use a proper material. You're going to use a disinfectant because it's a body fluid to clean that up. You're going to put that in the garbage can, and then you're going to, when you're done cleaning up, you're going to sanitize that area, okay? I would take my gloves off, put on new gloves, and I would sanitize that area, put all that trash in the garbage can. Then what do? You take the garbage bag, and you take it out to the dumpster, okay? Because we don't want that stuff left in there. All right, who's responsible for cleanup? You are. You. All right, what's the correct way to clean up? I just told you, right? So cleaning, the health department wants us once a day to clean with soap and water, like on our mealtime tables. And then you can clean with soap and water and then come back and sanitize that, okay? Just like a diaper changing, we want to disinfect and then we should sanitize it before the next kiddo gets on there. And then we talked about proper waste disposal. Like with the diaper is what? Pull the diaper over pull the gloves over the diaper, double glove it. It helps contain that seal. Make sure those diapers kiddos can't get in there, that there's a lid on there or it's in a cabinet where they can't get to it. Cleaning, wear gloves, paper towels, soap. Come on, y'all know how to clean. Sanitizing. So we talked about that specifically in our orientation. I won't really go into that too much, but wearing gloves when necessary, cleaning it first, owner's directions. That's why we put the directions on the back of our sanitizing and disinfecting. And again, this is designed to reduce germs and inanimate surfaces. Disinfecting destroys or inactivates germs on any inanimate object. Gloves when necessary. With harsher chemicals, especially you want to use gloves. Clean first, then disinfect. And again, we've talked a lot about waste disposal. Diapers, double it. Make sure it's out of reach. Some things that are regulated. Again, double glove it, Walmart bags, that kind of stuff. Best thing to do here is get that stuff. We're not disposing of prescriptions or extra medicine or an EpiPen. So with us, we're talking about body fluids. Bag it, get it out of there, and remove it out of a room where children are present. All right, what would you do if a student in your care has a nosebleed? Blood gets to the floor. After you care for the student, it is most important to what?
E, clean and disinfect.
Yeah, you want to clean. When blood gets to the floor, after your care is most important to. So, yeah, I would clean, disinfect. If it's on the floor, you could stop there. Okay, you want to clean it up, the blood, and then disinfect it, okay? If it was a surface we're going to have contact with other than the bottom of our shoes, then I would sanitize it as well, okay? All right, you have a student in your care who vomits on the shelf where toys are placed. What are you going to do about this? Answer is C. We're going to clean it. We're going to disinfect the toys and the shelf and all that. And because kids who have contact with toys, we want to sanitize it. So again, sanitation is for where we're going to have just skin contact. So we don't want to disinfect a surface and kids eat on it. You never want to do that. Just like a diaper change table, we're supposed to disinfect, clean it, then sanitize it before they get back on there. All right, here we go. What if there's an exposure incident? Splash in the eye or mouth, bites break the skin, puncture wound, sharp object, and so forth. Okay, what is? Okay, here's just definition of what is. What is not? Contact with the skin. A bite that doesn't break the skin. Okay, remember that bloodborne pathogen has to have an entry. Okay, so a contact doesn't necessarily mean entry. Okay, if you get exposed, wash, flush. Okay, report to a supervisor and document. If you believe you've been exposed, there's been a bloodborne pathogen, otherwise had a route to get in you, then medical evaluation. You are entitled to go seek medical treatment at no cost to you. This includes healthcare providers' written opinion, confidentiality. You will be offered, or you can request, either way, a Hep B vaccine. So if you didn't have a Hep B vaccine previously and you had contact with blood, that would be a time when you would want to do that no later than 24 hours after the event. Okay, it's a 3-shot series. Have fun with that. If an employee refuses Hep B series, then the employee signs declining to have the vaccine. And you may request series at a later time. All right, here's a couple scenarios. What are some tasks in child care that may pose a risk to infectious bloodborne pathogens? Scrape knee. Diaper changing if they have blood in their stools. Okay. Loose tooth, nosebleed, smack on the head. You got it. Ways to protect yourself while performing these tasks? Gloves. Best way to start. You're cleaning up preschool classroom. You notice a stack of books been left out, and then you see blood, spots of blood on the books, and you remember putting a Band-Aid earlier on that child who said they cut himself on a book. What would you do? What would you do? Yeah. So first thing we're gonna do is we're gonna look for any possible blood on those books. You got 10 books. You find 2 with blood on them. I'd put them aside. I would clean and sanitize the others, and those could go back. Those books with blood, because that book is going to be porous, you're not going to be able to remove that completely. I would dispose of that properly. You got it. All right, you're caring for a child with a bloody nose, sneezes in your face, and gets blood in your eye. What steps do you take?
Start by rinsing out your eyes and.
Yeah, we're going to flush out your eyes. Got it. And when you flush out your eye, you want to flush it from the inside out. You flush it this way, it goes from this one and then into the other one. Okay, drinking fountain is a really good way to do that. We typically will have an eye wash flush kit in our first aid cabinet, and which is just like a saline solution. You could use a cup of water if you're at the park, something like that. Flush, flush, and flush. This procedures can protect yourself in the workplace, reduce risks, and only works if you practice all the time. You guys have any questions? Questions? Do you have any questions? I'm available 24 hours a day, 7 days a week for questions. So if you're at home and watching this at 2 a.m. and you have questions, my phone line is open. So call me if you have any questions. All right. When you turn in that test, and we'll do a test here in a second, turn that in the director. We'll put some gloves on you, put some paint on you, talk about that one scenario, and get y'all certified. So thanks, everybody. Here's the test. That's it. Be done.